Hello. So we're going to continue our lectures with the lymphoid tissue. So you should have learned about the lymphatics, the lymphatic vessels, and so that's the vessels that carry the lymph. And so we're going to talk about the tissues that are associated with those lymph vessels. And when we're talking about lymphoid tissue, we're really talking about immune tissue. Okay, so you're going to cover the immune system, and the tissues that we're going to talk about today are also part of the immune system. Because some people don't really like to separate lymphatics from immunity. They kind of put them together, and in some books they separate them out. For me personally, I think lymphatic and immune should just be one system because they work together. But again, every textbook and every professor is a little different. But for me, they go hand in hand. So your lymphoid tissue are the structural basis of the immune system. The immune system has to occur somewhere, and so this is where a lot of the things that occur with or happen in immunity happen in these organs of the lymphoid organs, lymphoid tissues. These are where your phagocytic cells are housed. They house the lymphocytes. Okay. They are a place, I call them, they're like watchtowers. It's where lymphocytes and macrophages can survey and watch for antigens, those foreign things that mark things as foreign. So it's like a surveillance point for your lymphocytes and macrophages. Most of your lymphoid tissue is reticular. So if you remember, the word reticular is like web-like connective tissue. So it's very porous, so it's like a big sieve so that lymph can flow through it, and then those lymphocytes and macrophages can kind of watch and mark things that are foreign. It's also a place for B cells to germinate, and we're going to talk more about what B cells do when we actually talk about immunity, but B cells can germinate in these tissues. And so some of the tissues that we consider lymph organs are your spleen, your thymus, your tonsils, lymph nodes, and there are some other smaller lymphoid tissues. So we're going to go through, we've already talked about lymphatics and the lymph vessels. Now we're going to talk about each one of these different lymph organs and kind of tell you in particular what they do, where they are, and what they do. So on this slide, what's in yellow are those lymphoid organs. Okay, so you have tonsils, and so all these little yellow things are tonsils. We're going to talk about where they are and the names of those and how to find them. The thymus, okay, and it's something that you probably don't have. It typically goes inactive around adolescence. So you have it in childhood and then it goes away. So you can kind of think of, you've already been exposed to just about everything, and so we've marked everything that you need to mark as foreign by the time you're an adolescent. So that just kind of atrophies. Again, we'll talk a little bit more about how that works in the immune system. The spleen, and we talked about the spleen when we talked about red blood cells. It's going to be part of the system that gets rid of the old spent red blood cells, but it also plays a role in immunity. You have what are called Peyer's patches and the appendix. Okay, so these little Peyer's patches are on your intestines, and then the appendix is well, the Peyer's patches are on your small intestine, and the appendix is on the large intestine. So that's where these are anatomically. And so the lymph nodes are the primary lymphoid organs of the body. Okay, they're embedded in your connective tissue, and they align with the lymphatic vessels. So as those lymphatic vessels are heading back toward the heart, they will coalesce into these lymph nodes. Okay, and they're usually found near the body's surface. So a lot of times you can feel them, especially if they're swollen. And we name them based on the region that you find them, like your inguinal region, axillary region, or cervical region of your body. And their job is to filter the lymph. Okay, and there's macrophages inside these lymph nodes that can destroy microorganisms as they pass through. Again, this is also where we start to activate our immune system. And so as things are flowing through, we see them as antigens or foreign. This is where we mark them and start the immune response. And we'll get more detail on that when we talk about immunity. All right, so let's go the other way. All right, so again, these lymph nodes, all these little green dots are the lymph nodes. Okay, and again, as the lymph's flowing through, it's going to go through these lymph nodes on its way back to the blood circulation. Okay, so again, if you had to name the lymph nodes, or if someone said, oh, you've got something in your inguinal lymph nodes or your axillary lymph nodes or your cervical lymph nodes, we're naming those based on where we find those. So cervical lymph nodes are going to be in the neck, axillary up under the arms, and inguinal kind of where your thigh and abdomen come together. Now, lymph nodes have a particular shape. We've talked about form follows function a lot of times, and the lymph nodes are no exception to that. You have what are called afferent and efferent lymphatic vessels, and anytime you see the word afferent, that's usually going toward, and efferents are always going away. Okay, so an afferent is taking something like afferent nerve impulses take things to the brain, and efferent nerve impulses take things away from the brain. So afferents go to something, and efferents go away from something. And so you have afferent lymph vessels, and you can see those little valves. They're the lymph vessels. Remember, the lymph travels a lot like the venous blood does, using the muscular pump, respiratory pump, and valves. And as the lymph enters into the lymph nodes, you have 1, 2, 3, 4, 5, in this particular slide, 5 afferents. Well, as the lymph now is in this reticular material, remember it's real reticular, it's like a web-like, like a sieve, and as that lymph is going through that reticular web-like net, then you're going to have those macrophages and lymphocytes kind of watching out and surveying and marking for antigens. Well, because you only have 2 of these efferents going out, so you have 5 versus 2, that kind of causes it's like a traffic jam. Imagine a big interstate where all the when you all have a lot of lanes of traffic coming, and you have to everybody merge to 2 lanes. Well, what happens? It slows down, and so that's exactly what's happening. You're merging all these lanes into 2 lanes. That slows that flow and causes it to kind of back up and slowly filter through that reticular network, giving the macrophages and lymphocytes time to do their job. Okay, so form follows function. And all of this is surrounded by a capsule which gives the lymph node its shape. All right, now the spleen is your largest lymphoid organ, and if you remember, if you think about the body, it's going to be that little comma-shaped organ that's kind of toward the kind of on the back left side. And it has a really good blood supply. So a punctured spleen can be really dangerous because there's a lot of blood in a spleen. It has a large splenic artery and splenic vein that go to it. And its main job, it really has 2 jobs. The spleen has the job that we call the immune response job, which is where lymphocytes can proliferate, and we can survey what's coming through the spleen, and again, see those antigens, mark them, and cause an immune response. And then we have the part of the spleen that's getting rid of red blood cells. So if you look at how these arteries and veins are kind of spread out into the spleen, you'll see what's called white pulp, which are these white areas, okay, and then the red pulp, which are these kind of red areas. And so the white pulp, this is where we're surveying and responding from the immune system. So this is where we're proliferating our lymphocytes, and we're surveying for foreign antigens, okay? In the red pulp, so think red blood cells, this is where we're getting rid of your old and spent red blood cells. You also have macrophages in this area so that they can remove any large debris. Okay, so red pulp and white pulp. So the white pulp is more the immune response. The red pulp is more for getting rid of debris like red blood cells. Okay, so again, you'll learn, this is going to kind of build as we talk about immunity in future lectures. All right, your thymus, so if you think about, here's your heart, then just right over the heart you have what's called the thymus. And this is really important in early life. This is where we form our T cells, okay? And this is where your cells are programmed to know what is self and what is non-self, okay? So you're born, you have these T cells, and you've got to figure out, your T cells have to figure out what is you and what is not you. So that's all going on in the thymus. You're programming these cells to recognize things that are foreign or not foreign. And it's really active in childhood. I think I've already said this, where you're kind of exposed to everything you're going to be exposed to. That's kind of the thought. And then once because back, if you think about the human existence, most people don't wander very far from where they are. So your habitat where you are, you're exposed to pretty much your entire ecosystem within your childhood. Things are a little different now because we do travel more globally. But then, of course, we have things like vaccines that can help us with things that we've maybe not encountered before. So we'll cover a little bit more of that when we do immunity. So again, when you get to adolescence, it will actually start to stop growing, it will atrophy, and it's really hard to find. You may just have very little, if any, as an adult. If you can find it, you're still making some cells, but they're really slow. So again, it's really hard to find a thymus. When I've done cadaver labs, we always look, and I know it should be there, but it's really hard to find on a like a 90-year-old cadaver. One thing about I like to throw this in the thymus. If you're an adventurous foodie, I am. I'll eat anything. If you go to a restaurant and they have sweetbreads on the menu, that's thymus, okay? It's usually calf thymus, okay? It can also be pancreas, but a lot of times, and just ask them, is it thymus or is it pancreas? Usually it's thymus, and it's really good. All right. Some other lymph tissues are called the MALTs, or mucosa-associated lymphoid tissues, or MALT tissue. And these are just kind of spread throughout. They're not like these large organs, kind of like the spleen and the thymus, or in the compact lymph nodes. They're just kind of mucousy type membranes. And so examples of these MALT tissues are your tonsils, something called your Peyer's patches on your small intestine, and your appendix. And you also have some in your respiratory system and your genitourinary areas, okay, and parts of your digestive tract. So think of anywhere that you might be exposed to the outside, or to something entering into your body from the outside. You're going to have some kind of this mucous membrane to try to catch anything foreign before it enters into your body. So your digestive system is just a long tube throughout your system, and so you're trying to catch things as it's moving through. You're breathing in air, so you want to try to catch things as they're going into the lungs. So anytime that there's exposure to the outside world, you should expect to see things that can hopefully protect you. All right, so the tonsils are the simplest lymphoid organs, and they have a set of 4. You have palatine tonsils that are at the back end of the oral cavity. You have lingual tonsils that are kind of under your tongue. You have pharyngeal tonsils that are on the back of the nasopharynx, and then tubal tonsils that are near your auditory tubes, or your eustachian tubes, if you've ever heard of that. So is your pharynx, if you think about, well, let's go to this next picture. If you think about the pharynx, that's the back of your throat. You have the nasopharynx behind your nose, the oropharynx behind your mouth, and the whole thing is called the pharynx. So you have pharyngeal tonsils, you have palatine tonsils, and lingual tonsils, okay? So this is, as things are, you're breathing in, you're drinking, you're eating, you're exposing that whole area to outside sources. And so the thought is, as you're breathing in air and breathing in or eating food and water, this gives these tonsils a chance to hopefully catch anything that's foreign that needs to be removed from your system. And so tonsils have these large pits, and so things are supposed to fall in there and get stuck and then be destroyed. So people who have tonsillitis, who are sick all the time, a lot of times if you look in the back of their throat with a flashlight, you'll see these huge pits. The whole things are red and inflamed. And for some people, it causes more harm. They don't work. They just stay inflamed when you have tonsillitis all the time, and so they'll just actually go in there and do a tonsillectomy and take them out. So don't be surprised if maybe half my class has had a tonsillectomy, because for some people they don't really do the job. They cause more pain than they do helping you fight off infection. Typically they don't take all your tonsils, so they may just take the ones at the back, the back of your throat, and leave your pharyngeal tonsils there. Your pharyngeals are also called your adenoids, and so sometimes if you have if they're swollen all the time, they may take those out because they're behind your nose, and so it kind of gives you a resonance. And so a lot of times if you have adenoids that are acting up, it makes you talk funny. So it's all swollen, and you sound funny, like you're talking in a tube or something. And so they'll take those adenoids out of those pharyngeal tonsils, and that'll help you sound better. Okay. You'll also take out your palatine tonsils. If your throat's sore all the time, it makes it hard to talk. People get laryngitis a lot if they have tonsillitis. So, like I said, I wouldn't be surprised if half you guys out there have lost either your, at least one set of your tonsils. And then lastly, you've got some small mucosal, these small malts. One are called the Peyer's patches, and they're little lymphoid follicles. They're not very big, and they're found all along the distal end of the small intestine, okay? And so their job is to, again, just watch for those outside foreign things that are coming through your system and try to help you eliminate that. And then you have your appendix, which is on the large intestine. It does the same thing. There's some, questions about what the appendix actually does. There's some studies that say maybe it's a storage place for good gut bacteria. Some people think it plays a role in immunity. Regardless of what it does, you don't have to have it. So if you have appendicitis, if it tends to cause you more harm than good, kind of like your tonsils, they can simply take it out. Let's see. All right, so that's all we're going to talk about lymphoid tissues. Then we'll start talking about the immune system next. Thank you.